You guys want to turn on your cameras, or Ikea and Shante, do you want to turn on your cameras? So I'm going to go over a couple of things. I have a critical thinking kind of test taking strategies PowerPoint I want to go over with you, and then we'll review the or which do you want to do first? We can review the concept guide and then do what do you want to do first?
Yeah, the concept guide first.
Okay, let's do that. All right.
And I have a few minutes, but then I'll turn it on. I'm eating. I've been online since 9 a.m.
That's
So
okay.
I'm just now.
Yeah, no worries. No worries. All right, let me share my screen. Okay, can you guys see my screen?
Yes.
Yep. Okay, can you hear me, see me, everything okay?
Yes.
Okay. All right. So here's your concept guide. So you've got your week 4 concepts listed out, your week 5 concepts listed out, and your week 6 concepts listed out. With each of those 3 weeks, you also have notes that I've sent ahead that we've used in class. Okay. So you're going to see a lot of information that is in this guide that's also from your concept notes, your weekly notes. So this is an abbreviated, this guide is an abbreviated version of your concept notes, your readings, your Canvas readings, and lecture. Okay. In our weekly notes, we cover the concept really kind of big picture. All right. This is a more focused version of each of the concepts with what are the most important items or knowledge to know about each of the concepts for the exam. So as I always say, start with this guide, okay, with all the concepts. If you're not understanding any of the concepts, go back. You have other resources to fall back on. You have your weekly notes to fall back on, right? You have your readings to fall back on, and you have your Canvas readings, if they're applicable, to fall back on, right? Okay. Okay, and then I've copy and pasted all the readings for week 4, 5, and 6, if you need to jump back to do any additional readings. Okay, there's nothing different about this exam than other exams. 50 questions, 5 math questions. You know, if you're struggling with math, I continue to encourage students to go back, and in week 1, I shared a tutorial. I shared a tutorial from Professor Bogart, who's a PEDS instructor. And she does a very simplistic math tutoring session, and it goes back all the way to the basics. Okay, conversions, setting up equations. And what she teaches you in this tutorial is what are the questions, math questions on these exams. They're really simple. Okay. So if you struggle with math, you need to go back and do that. Okay. All right. So as we go through this, remember excuse me, the exam is clinically focused, right? So it's taking the knowledge from this guide and applying it to practice. Okay. So what do we want to know about in general, special vulnerable populations, poor health outcomes compared to other people, right? With regards to morbidity and mortality, right? We want to know that we know these are some facts about vulnerable populations. High prevalence to chronic illness, hypertension, communicable diseases, infectious diseases, maybe TB, hepatitis, STDs. Okay, so given what we read here, putting this into practice, what kind of question might be asked?
Like what kind of health risk could maybe like a homeless person or migrant worker have?
Mm-hmm.
They're vulnerable populations for kind of chronic health
Yeah.
problems that they have.
Or, yes, and considering the question is about vulnerable populations, maybe what is their high risk? What is their high prevalence? Or do they have a high prevalence too? All right, maybe select all that apply. Right, so why do we talk about special vulnerable populations? What are they more at risk of? Right? Does that make sense? Okay, let's, as far as pregnant adolescents, what do we want to know about pregnant adolescents? Well, we know that we talked about pregnant homeless teens as a subset of that. I mean, risky enough to have pregnant adolescents, but then you have pregnant homeless teens. Okay, so this first bullet goes through what they have higher risk for: STDs, incident, alcohol, mental health, poor nutritional status. Right? So again, let's formulate a question. Right? This bullet is about why pregnant adolescents, pregnant homeless adolescents are so at risk. So let's formulate a question.
Why are they at risk?
Why are they at risk? What are we looking for? In our nursing process, in our clinical evaluation, well, we see here elevated blood pressure. Maybe they have a positive STD test. Maybe they're not seeking prenatal care. They're doing it too late. Right? So maybe what are our biggest concerns as we're doing our clinical assessment?
Homelessness.
Yeah. Okay, the next bullet is about postpartum visits. We talked about this in class. So we're doing a postpartum visit. What are we looking for? Let's say you're in the home, clinically assessing the client. What are we looking for?
Checking to make sure they basically know how to care for the baby, or make sure they know like the requirements of like I guess like with the baby growing or
Yep. Growth
safety.
and development. Yep. So the primary goal will be to assess how much the mother knows and understands about the needs of the baby and their development. Right? Primary goal of a postpartum visit would be to assess the knowledge regarding normal growth and development. Okay? So let's formulate a question. When you're the home health nurse, you're going into do an assessment on a new mom, a new teen mom. What is the most important thing you're going to look for?
Knowledge of growth and development.
Exactly. Right, so formulate your questions as you're reading through these, thinking clinical. Okay, so the next one, we know that there's a correlation that exists between poverty and poor health outcomes, right? This is the bullet that addresses what is one of the biggest issues with teen pregnancy: dropping out of school, right? So that's what this addresses. So what question might we formulate? If a pregnant teen, we know the associated risk factors. What's the most important thing to do or work with pregnant teens?
To get them back to school as soon as possible.
Getting them back to school. All right, it's important to keep the pregnant adolescent in school during the pregnancy and have her return to school as soon as possible after. Okay, so you're taking each bullet, what information is provided in the bullet, and think of a clinically posed question. Okay, make sense? Okay, the LGBT population, what did we learn? Okay, the first bullet is about providing culturally competent care. It talks about sometimes nurses can feel somewhat of a degree of discomfort taking care of this population. Okay, so it's important for us to sort out our own feelings before we can be comfortable taking a history from this population if we're not comfortable hearing about sexual history, social histories. Okay, so take that bullet. What's a question?
Nurses provide culturally competent care to LGBTQ people, clients.
Right? So what's the question? What's the first thing you have to consider? I'm thinking, what's the first thing you have to consider when working with this population?
You have to
Uh,
consider like their feelings or how do
Check
I
your own
s-
feelings.
yeah.
Isn't that what this is saying? Nurse must be aware of his or her feelings before beginning a discussion. Okay. And then this is important too. Homosexual behavior in adolescence is not uncommon. Okay, adolescents often desire to explore alternative lifestyles. Okay, so that bullet has to do with assessing our own feelings, right? We have an ethical obligation to provide culturally competent care, but if we personally have barriers, we need to address those. Right? The second bullet talks about, let's assume all those discomforts or you don't have any or they've been resolved. Okay, so now we're meeting with the client. What's the best way? What's the best approach? So now you're in a clinical setting meeting with the client. Go ahead,
Be
Abigail.
non-judgmental. Be non-judgmental to them.
What kinds of questions?
Can ask them if they're in a relationship or if they have a partner.
Versus what? Are you married? Do you have a boyfriend? Do you have a girlfriend? How do you ask those questions in a non-judgmental way? Right? So that's
Would
what
you
that
call your
bullet is.
partner?
Go ahead.
You could ask them what they call their partners.
Exactly. Right. Culturally competent care. The next is CDC. This talks about what are the annual screening recommendations for this population. Pretty simple question
Um,
to formulate. What is the
Trying to read.
CDC's annual recommendations and select what it is, right? So it's 5 things: HIV, syphilis, gonorrhea, genital herpes, and chlamydia. Okay. However, the rest of that says that if they're at higher risk, okay, they're at risk because of their current status, but if they're at higher risk for a few different reasons, multiple or anonymous sex partners, or using illicit drugs, then the recommendation goes to where? It's shortened to 6 months. That's what that says. Okay, so this bullet is asking to know about or be aware of what is recommended for annual screenings. And when would the time frame be bumped from a year to 6 months for the higher risk? You with me? Okay, we have
Yes.
lots of issues. We have lots of things to know about mental illness, anxiety, mood, and eating disorders. Okay, so in this section, could you pick out, after reading about general anxiety disorder, and you were given a or let's see, phobia, OCD, PTSD, and bipolar. Okay, so we've got 5. If you were given some scenarios, could you pick out what mental illness that was pointing to? Because that's what you're going to be asked. All right, so you've got 5 of them here. Okay, so you need to have an understanding of each of them. Right, so for example, if you were given a scenario of somebody who is experiencing excessive worry about multiple things over a long period of time, That would be a generalized anxiety disorder. Right? If you were given a scenario of somebody who has irrational fear from something specific, right? Phobia, OCD, recurrent, intrusive. You just need to have maybe a one sentence definition of what each of these are. Okay, you have to be able to take a scenario and say, oh, that's a client with OCD. Oh, that's a client with PTSD. And they're all have their own specific descriptions. Okay? Bipolar experiences extreme sadness with hopelessness, helplessness, with also periods of extreme hyperactivity and elation. Okay? And then the one thing to pull out with the bipolar is the lithium. So I have it highlighted. Let's say you were teaching a client who is just diagnosed with bipolar and they were put on lithium. What are you going to be teaching? What are your instructions going to be? Reach out if right here.
Rehab, first coordination,
Yeah.
like the healthcare provider.
Say that again.
If they have diarrhea,
Yep. Tremors, lack of coordination. There's your side effects. So there's your teaching topics right there for
Doesn't it take a couple of weeks to get in their system also, the lithium?
Mm-hmm.
That would be a teaching tool. They ask like why, I don't feel any different. It's a
Yep.
week.
Yep.
It takes a couple of weeks.
Absolutely. Absolutely. So what would we ask about lithium? When you're teaching a client who's been recently prescribed lithium, what are you going to teach them?
Encourage them to have the normal salt intake,
Exactly.
drink the fluids, and
So clinically focused, you're doing teaching, right? So be able to identify each of these 5, GAD, phobia, OCD, PTSD, and bipolar. And I think I've provided a pretty short, direct definition of each of them. So it would be trying to identify a client scenario with certain characteristics. Right? You guys know what a patient will present with PTSD, right? Or OCD or GAD. Okay? Make sense? Then don't forget about eating disorders. That was part of, we didn't really cover it in class, but you're going to get asked about this too. Okay, don't forget, I would review the section, where is it?
in chapter 48 of
Yeah,
the
right
med-
there, chapter 48 in your med surge book from week 4. Okay? No, chapter 47. Chapter 47, care of patients with anxiety, mood, and eating disorders. Please review that eating disorder section. Okay, you have to be able to identify a scenario in which it's not so much a mental illness, but more of a eating disorder. So give me a scenario. Give me a patient scenario that potentially is an eating disorder. What do they present with? What do they look like?
won't they be like underweight?
Underweight, yeah. What else?
Get really thin.
Mhm.
Anorexia,
Yep.
Don't have that much hair.
Mhm.
bulimia,
What if a kid's doing a physical and they really don't want to get on a scale for weight, right? Their height and weight doesn't meet the normal standards. They don't want to talk about it. They don't want to be assessed. Is that a problem?
Yes.
Yeah, of course it is. Okay, so have a look at that section. Okay, substance abuse. So within substance abuse, we have alcohol, we have tobacco, we have e-cigarettes, we have cocaine, amphetamines, methamphetamines. Got to know the difference of each of them. Okay, clients presenting with different scenarios. Okay, what do you do? Let's take tobacco. All right, what do you do with a family that kids have asthma and it's a smoking household? What are you going to do with the family to try and move that towards a non-smoking household? What kinds of specific teaching and education you're going to need to do?
Could you just inform them like that secondhand smoking, if they
Mhm.
have kids, is just as bad as the smoking?
Mhm. What if they say, I don't really smoke anymore. I use e-cigarettes now. Is that a problem?
It's
that's
worse.
Yeah.
it's work.
Okay. So if you get a question, let's say you get that negatively framed question about, I'm just throwing this out there. What is after you've done all your teaching about smoking and secondhand smoking and kids with asthma, and a parent says, oh yeah, I switched to e-cigarettes. That tells you number one, she didn't hear what you said. Number two, you gotta go at it from a different direction, right? But that requires more teaching, right?
Mm-hmm. Maybe teach her about the patches and the gums they have out there.
Mhm,
Different medicines like Wellbutrin that's supposed to help with it.
mhm. Smoking cessation programs,
Mm-hmm.
maybe moving her smoking outside, at least for the time being, not smoking in the car, right? Um, and then you've got your cocaine, your meth, amphetamine, your amphetamines, right? These are all stimulants, and they're very much associated with cardiovascular complications. Okay, so specifically, high body temperatures, high heart rate, high blood pressure, requiring emergency attention. Okay, so what's a question for that?
What would be an emergency cocaine or
Suspected methamphetamine overdose. What might you,
what
what are you gonna see? What are they gonna present with?
could be a priority too?
Right, right. What's a priority to look for? High body temperature, high heart rate, high blood pressure. Okay. All right, questions about week 4. Does that make sense? That's how I want you to look at them. Look at each of these bullets, okay? 5. Last week we covered death, dying, hospice, and palliative care. Okay, need to know the difference between hospice and palliative care. Who wants to take a stab at that?
Hospice is for like end of life care, and
Mhm.
palliative is taking care of people who have a terminally ill like disease or something.
Mhm. But are not ready for hospice yet. Okay, yeah,
Correct.
excellent. Everybody understand that distinction? I know it's used interchangeably most
So
of the time.
step before hospice.
What?
Palliative is a step before
Yeah.
hospice.
Yeah. iPhone, who is that?
Oh, Kristen.
Kristen?
Mm.
All right, put your name instead of iPhone so that you get credit for attending, because I have to send this off to Dean Brown, who's attending, so put your name in there. Okay, what are we doing? What's the hospice nurse doing? What are we focusing on?
Keeping them comfortable until they
Okay.
pass.
Mhm. Improving the quality of life, keeping them comfortable, trying to alleviate as much suffering as possible. And don't forget, we have our client, but we also have the family. Although our client is the most important, we have to consider the needs of the family as well.
Advocating for our patient if they need more pain meds, things like
Yep.
that.
Yep. Not concerned about addiction and all
Mhm.
that. We're concerned about keeping them comfortable. Right? But we don't want to, we don't want to have them so sedated they don't know what's going on either. All right. What do you do with a family that may not agree with, let's say you're practicing your ethical principle of autonomy and giving your client as much decision making in their plan, right? For hospice care. And if you've got family that don't agree, the client doesn't want any more chemo, they don't want any more radiation, they don't want any more tube feedings, and you have a family that's not really on board. What do you do? Again, these are clinical scenarios.
Focus on the needs of the client.
Yeah.
And support the client and what he wants to do, rather be talk to the, didn't we have a question like that already though? That it was like, it was, I forgot how it went, but I know it had something to do with supporting the client to talk to his family.
Mm-hmm. Mm-hmm. Well, obviously your clients are primary, but in a hospice scenario, you've got to try and get with the family as well to maybe try and understand where they're coming from. It may be a lack of understanding about hospice care. It may be a lack of knowledge. Maybe they don't agree with it, but the family is part of the hospice care group. Does that make sense? So you have to try and do your best to try and elicit what's going on. Okay. Okay, focus on the needs of the client, keep the client comfortable, maintain dignity, self-esteem, not sedated. We talked about that. Client should be able to interact with family members, make care decisions. We just talked about that. Focusing on symptom management and comfort care, right? Pain control is priority. One thing to remember is I think we reviewed this in class, is sometimes dehydration is okay. Okay, your dehydration in the terminally ill patient has actually been shown to decrease the pain and have the client more comfortable. Why do you think that is?
Because you're not forcing fluids when they don't feel like it.
Right. So remember that. And then also be familiar with the stages of grief. Everybody's in their own stage, from the client to family members. All right. So this bullet talks about stages of grief. If you're given a scenario of, a hospice client, you're working with the family and maybe a description of behavior is presented, what stage of grief is that? Right. We know the first stage of grief is denial, right? And at that point, what do? We remain with the client family member, right? And then comes acceptance, right? So your acceptance of your feelings, it's actually an intervention for the acceptance stage. And then you have your bargaining stage. Okay. And so on. So just be able to identify a behavior and what stage of grief that may be. Okay. And then about the coroner, I know this is kind of out there, but you're going to get asked about this. So what kinds of cases does a coroner investigate? Okay, so the primary cases, people that are not under the care of a primary care physician, suspected suicides, and a death from injury. Those are the three primary cases they would be involved in. They're not going to go and investigate all deaths in a hospital or all deaths in a home, right? Very specific and targeted. So know that. Okay. Next section, spirituality and culture. getting back to our culturally competent care, right? So for us to be providing culturally competent care, it requires that we have an understanding of our own attitudes and beliefs and biases and stereotypes, if they exist, right? But cultural competence, approaching individuals as unique individuals, right? We can't make assumptions. We can't be judgmental. We can't place our culture above others, right? We have to try and accommodate different cultures, attitudes, beliefs, values as much as we can into the plan of care, whether it be food preferences, practice preferences, visitor preferences, communication, right? As much as we can. Okay. And then have an understanding of the time. You know, we have cultures that focus on past, present, and future. If you're focused on the past, what are the risks? Right? Sometimes you have such a preoccupation with the past that you're unable to make decisions for the future. Right? So if you're given a scenario, identify whether it's a past thinking, a culture that is focused on the past, the present, or the future. So present, if you're present oriented, you're focused on the here and the now, right? You're focused on the quality of life for now, right? Decisions that make you happy for the present. But it can sometimes fail. You fail to plan for the future, or you consider future consequences if you're living in the now, right? And then if you're future oriented, if you are in a future oriented culture, you're more likely to make sacrifices in the present, right? In order to achieve your long-term future goals, you make sacrifices so that those don't happen. So and because this is cultural competence, we have to be able to recognize what are the main cultures that are past, present, and future. Okay. Ethical and legal issues, right? Obviously, the first step in ethical decision making is, what's the issue? Is it an end of life issue? Is it a treatment issue? And we're faced with, in our profession, we're faced with ethical conflicts all the time. But the first thing, obviously, in ethical decision making is, what's the issue? Okay, some ethical principles you need to know about are beneficence, right? What's beneficence? We had a quiz question about that.
Doing the most good at all times, no matter what the circumstance.
Yes, beneficence is do good, right? So the expectation is that, well, what is ethics? Ethics is doing what's morally right, for the good of all, as much as we can, right? So we do the most good within the circumstances we have, right? So an example would be maybe with a hospice patient, ensuring pain control or pain management, right? What's non-malfeasance?
Doing no harm whenever possible.
Doing no harm. So what was the example we talked about? It was one of your quiz questions about the
catheter.
Yep, contaminating the catheter. Right? So
Getting
what
a
was
getting a new kit?
right, because we don't want to cause harm. Right? So beneficence and non-malfeasance are the two primary ethical principles that we practice by. However, there's two more. What's autonomy? The principle of autonomy. Think about it. What's autonomy?
Has-
Oneself.
Like the
Yeah.
self-government.
Exactly. We advocate for the client to be as autonomous as possible, right? We want them to be part of their planning. We want them to be part of the planning for what they want to happen. right? That's autonomous. And then the other is, so for example, autonomy, respecting the client's right to stop treatment, right? We have to respect that. Okay. And then the last one is distributive justice. What's that? Think about it. Distributive justice.
Being fair, providing good care to
Correct.
everyone.
Exactly. Exactly. All right. Did everybody hear what Abigail said? Okay. Making sure of across the board access. Distributive justice. Okay. All right. The other thing to think about with ethics and legal issues is documentation. All right. We all know what factual versus non-factual documentation is, right? Factual, right? Description, objective information about what you see, what you hear, what you feel, what you smell. All right. So what would that be? Give me an example of a chart entry that is appropriate. When in
What
the
do you mean?
patient's room, the patient's blood pressure was this, the patient's pulse was this, right? Objective, descriptive, patient was sweaty. Okay. It's a description, objective description, so it's factual. Okay. Using inferences without factual data, you can't chart that. Patient seemed to me in a bad mood today. Right? Patient, if the patient said, if the patient factually says something to you, you can document that, but your subjective observations are not factual, correct? So you got to be careful what you chart. All right, so that you can't use inferences without supporting factual data. Okay, so the use of vague terms, right? He seems, or he appears, or she seems, she appears. It's not acceptable, right? Because it just makes the assumption that you're stating your opinion. So you got to remember that. And then we have a bullet here about floating. Anybody ever been floated to a floor where you've never worked before and you have no clue? Me. Yeah. Happens all the time, right? Right? Nurses or everybody's floated all around the hospitals or their facilities, just try and resolve their staffing issues, right? Legally, you really can't refuse to float unless you have, I guess, a union contract that states that, but
Not in
that's
Florida.
not right. It's
Yeah, New York, maybe, not Florida.
yeah, exactly. So what could you do? You're floated to the PEDS unit, you've never worked with kids before. There's things you can do. What can you do?
The normal things like vitals,
Sure.
Give meds.
help
Can always
Wheeling
pass.
people down there being discharged, right? Providing food trays, right? But you are legally obligated to make sure that whoever you're reporting to knows what you can and cannot do, right? So sure, you can float, but really, here's what I can do, and here's what is not within my scope of practice. I don't have any knowledge or experience in this. Does that
We're
make
obli-
sense?
We're obligated to give them that information.
Yeah. I mean, what if you float to a PEDS unit and you start giving nebulizer treatments that you've never done before and you set it up wrong, or you give the incorrect amount of medication? Well, that's a
That's your
problem.
that's your license.
Exactly. Right. So it's recommended that you identify the potential areas of harm, right, that you cannot do, and identify what you can safely perform. Okay, and the reason why this bullet is in there is because there's some questions on this exam with regards to delegation. Okay? So, anybody have any questions about that? And then 6, environmental and occupational health. We went through that today. Is anybody from my Friday class here? Or are you all from Monday and Tuesday?
Yeah, I'm from Monday.
Who's from Friday? Abigail? No, you're all from Monday and Tuesday. Right. So we just went through occupational environmental health. It's an abbreviated version. All right. So what you need to know about environmental health, the kids are much more vulnerable to environmental hazards. Right? Their exposure to lead, higher risk of exposure to lead. Okay. Conducting an assessment of the workplace to learn about environmental exposures, right? This is the occupational environmental nurse. She needs to know about various jobs. We talked about that yesterday and today. Job descriptions, potential hazards within the job site, work practices of employees. What's the effectiveness of safety education and equipment? Right. And then the occupational nurse we talked about, her job is to keep the workplace safe. Right. Safe, healthy, keep people at work, minimize injuries. Right. No workplace is risk-free. And lastly, client teaching. So I broke all your occupational and environmental health information down to 3 bullets. That's what you need to know. Okay. And then client teaching, we talked about the biggest barrier to learning is literacy. Right?
Literacy and language.
What?
Literacy and language also.
Well, think about it. Yeah, language. Let's say you have a low literacy level because of a language barrier. Right? What do you do?
That's what we talked about.
That's what we just
Depending
talked
on what
about.
the situation, we make pamphlets for them depending on what it was.
Right.
Like whether it be teaching them about prenatals or teaching
Yep.
them about pesticides at the workplace, we
Mhm.
maybe make pamphlets for them
Exactly.
in their language.
Mhm. Well, and I don't know, one student brought up they have a new in their hospital.
That
They
was
have
me.
Oh, the iPad?
They have the iPad,
Yeah.
with
I
all the
mean,
languages and everything.
what a great idea. What a
Well, they
great
had to do
idea.
that because they had Longwood, where I work at, has so many different populations of people, so
Right.
they had to do that. So
Yeah. Psychomotor learning we talked about is dependent on you having the ability to perform and practice the skill. Right? That's not cognitive, the 3 domains: cognitive, affective, psychomotor. Psychomotor is simply the doing, being able to practice your glucometer. All right, being able to practice your nebulizer, being able to practice your oxygen tank. That's the doing. Okay. Remember, cognitive is the thinking, and affective is the feeling, how your attitudes and beliefs are going to affect the subject you're trying to learn about. And then discharge plan requires we look ahead, right? So we already talked about that. It starts at admission, right? Okay, so that's the guy. Is that helpful? Yeah, good.
Yes, very.
Thank you.
very
Okay.
helpful.
Good,
Thank you.
good. All right, let's just go through this real quickly. I mean, you can stay on or you can jump off, but I think I always
I have
like to
to
use
go,
this
Professor.
What?
I have to go. I'm sorry.
That's fine. That's fine.
Thank you so much for your
it-
time.
You're welcome, Abigail. You're welcome. So this is a good PowerPoint that I like to go through. It talks about critical thinking in answering fundamental questions. So these are practice questions. All right, so bear with me if you want to go through this. So it contains 10 practice questions at the fundamentals level, right? It makes you think through each question, right? And it also gives you rationales that can help us figure out how we're thinking about answering questions. So everybody read this first question.
It
Okay,
would
so-
be C.
Okay. Okay, right. But here's a few things to think about with each question. And we started doing this when we were doing quizzes the last 2 days. Does it have a positive or negative focus?
A positive focus because it'll give him a time to focus on his eating and not everything else around him, maybe.
Right,
Focus on swallowing, focus on drinking and eating
exactly.
and taking his
Exactly.
time to eat instead of having to rush.
Exactly. All right. Next question about this question. What are the key words? We were doing that with the quiz today. What are some key words in this question that you would highlight? Because I'm going to suggest that everybody use their highlighter in ExamSoft. All right. So what are the key words?
The dysphagia, the excessively coughing,
Yep.
the
And choking.
choking.
Right? So after you read this long question, can you rephrase it into something shorter that eliminates all the fluff that you really don't need? Okay, and look at how they've rephrased this big question. What should the nurse do when a dysphasic client is choking and coughing? All right, so try and rephrase that question. And then the last suggestion is what answers can you rule out immediately? Okay, obviously you can rule out A, right? He's choking
Mhm.
and coughing, right? A's totally inappropriate, right?
D could be inappropriate too because you don't know that he has dysphagia, so the glass of water would make him choke.
Right. He's
You
already
don't know if he's
choking.
on thickened. You don't know if he's on thickened liquids or what.
Right.
So
So you've already eliminated 2 answers. Okay, we've already identified the key words, dysphagia, choking, coughing. So you're down to 2 choices. What are you looking at? I think ABC's here. What's the right answer?
well, with B he could choke still because of the dysphagia. So tilting the head back might not work.
Okay, the correct answer is C. Right? Let's see why. So he's client with dysphagia is eating lunch in the dining room of a long-term care. Nurse observes they're choking and coughing. Okay. The best answer is transport the client to a quieter environment to finish eating his meal. What's the rationale?
Allow him to focus
Right. So,
on the task of chewing
well,
and swallowing.
if you have dysphagia, it's not that uncommon. All right. Not that uncommon to be choking or coughing. Right. So if we transport him to a quieter environment, maybe he'll be able to focus on the task of chewing and swallowing. Right. Additionally, maybe it'll reduce his risk for aspiration. Right. So it's getting, if you're choking and coughing, think about it. You're pretty frantic. So moving to a quieter environment where there's not as many distractions makes sense. Right. So transporting the client to a quieter environment will allow him to focus on the task of chewing and swallowing, reducing the unpleasant choking and coughing, reduce the risk of aspiration. Right. So let's go back to A. finish feeding and quickly return to his room, A, is going to increase the client's symptoms of coughing and choking. Right? And then it's not an upward tilt, it would be a downward tilt. That's why B's wrong, right? And then D, which is provide the client with a glass of water before he finishes, that often increases the swallowing issues. So this is just examples of breaking down questions. Does that make sense? And that's why I always say if you can get to a rationale, always take advantage of those rationales. They're all through your NCLEX assignments. Okay, so the nurse assesses, let's read the second one. Read this one. Okay, so let's answer the question. Is it positive or negative? Is it a positively phrased question or a negatively phrased question?
So positively, because it's just
Positive.
asking what should the nurse take to most accurately count the client's pulse rate? It's just a positive question.
Yeah, you see how that question was rephrased? Okay, and what can we automatically rule out? We can automatically rule out D. So now I've got 3 possible answers. Okay, the correct answer is B. Right? Did you know that? Did you guys get that correct? So a pulse volume of 1+ on a scale of 4 indicates that the client's pulse is weak and thready. To most accurately count the client's pulse rate, you should auscultate the apical heart rate for a full minute. That's the correct answers. Why are the others wrong? Since the pulse is weak, palpitating the radial pulse may result in inaccurate count. Will not improve C will not improve the client's volume. And yes, D is an important nursing action, but it won't enable the nurse to obtain a pulse rate. Okay, so this is just breaking down. It's just, I know these are med-surg questions, but they're breaking down how to answer a question. Okay, let's do another one. Okay. Let's go to the rephrasing question. Let's go to rephrasing first. That's a lot of information in that question. You could rephrase it to a simple question is, what is best to do for an alert ambulatory client who refuses to shower? Because that's basically what's going on, right?
Well, basically, they already said, well, what you would ask to highlight, she's an ambulatory female. So there's nothing wrong with her getting up from the bed to take
Correct.
a shower.
Right.
So I guess we would have to rephrase it to be like, wouldn't it be refreshing to take a shower with your, since you have your menstrual. But yeah, we have to rephrase it in a way for her to get up.
Right. Well, your key words, I can see the client's ambulatory, alert, oriented, right? And refuses to shower. Well, what's wrong with that picture? They should be able to do that.
Mm-hmm.
Right? So what are you going to, so what's the right answer?
A refusal, document the refusal. Are we gonna come across a question that has a negative? Because I'm not really understanding the positive negative part of it.
Okay. Okay. Well, the correct answer to this is instruct the client about the benefits because she's able to do it.
Oh, that's what I said.
Right? All right, let's go find a negative question. Here's one. Okay, here's one. And tell me why it's negative. The client's vital signs are right there. You can see it. Which prescription would the nurse be expected to hold? What does that mean? Right? There's a medication that we're not going to be giving. We're not supposed to be given if those are the vital signs. Does that make sense? So it's not moving ahead with a positive intervention. It's actually looking at what is negative about this situation that's going to require us to hold a certain medication.
Okay, okay, I get it.
Does that make sense, Kristen?
Ma'am.
Another example of a negative question would be after I'm just speaking off the top of my head now, after I've completed the discharge teaching with a family regarding a new type 1 diabetes diagnosis, what does the parents say that would require more education? Right? So what does require more education mean?
So they might say, I don't think my child needs that.
Correct.
That's a negative.
That's a negative. Or like the quiz question, I think I'm just gonna keep going with a keto diet. Well, no, we just went over a diabetic diet and it's not keto. Kristen, does that make sense?
Yes, ma'am. Thank you.
All right, so it's looking for something negative. Another example, I think this is in one of the RN exams about you are mentoring a new nurse and you're observing the new nurse doing discharge teaching with a client who's had a stroke. What does the new nurse say to the client in the discharge instructions that tells you that she needs further education? Right? So the negative part of that is she said something that was either incorrect or not complete. And so we need to go back and correct her. Does that make sense? I'm just trying to throw out examples of negatively phrased questions.
So are a lot of the questions on the test like positive and negative
No,
questions?
I mean, there's a couple of negatives. And I guess my point is you should be able to pick up on a
Differentiate.
negative question because it's actually asking you, you're kind of looking for the wrong answer. Right? What did that new nurse say to the family that you need to review with her? Right? Because it wasn't completely accurate or wasn't completely the answer wasn't full or complete enough. Right? So anyway, these are some of the questions. These are some of the things to do when you get a question. Is it positive or negative? What are the key words? We already talked about
It's
that.
asking a priority.
What
Is it asking
keywords?
Priority.
Right. So keywords would be priority, greatest. What are the keywords or phrases? So in this one, it would be vital signs. Right? Keywords, vital signs. If you can rephrase it, right? So think about it. They give you the vital signs and they say, what would you be expected to hold? If you want to rephrase that in your own mind, well, based on these vital signs, which medication should not be given? Right?
Mm-hmm.
And then what do you rule out? What can you rule out right off the bat? And the other thing you have in the exam soft, not only do you have the highlighter, but you have the line that you can draw through once you've figured out what you can rule out. Does anybody use that?
No, I didn't know we could do that. I'm gonna have to
Yeah.
play around
Yeah.
with that.
Yeah, I would highly suggest the highlighter for keywords and the line or the line out for rule out. Be a lot easier to tackle the question if you can identify those two right off the bat. Keywords, what can we rule out?
This is helpful.
Is it helpful?
Mm-hmm.
Good. Awesome. I don't usually do a review for a whole hour, but here we are. We did a whole hour. Yay.
Thank you, Professor Marvel.
Oh my gosh, you're welcome. You're welcome. As
Thank
long as I'll help you guys in any way I can.
All
And
right.
I'll send the recording on as soon as it's ready. I'll send it to all of you guys. And then you'll be fine. I appreciate you coming. I appreciate you guys coming. And so we'll go from there. How's that?
All right. We'll see you next week.
See you next week. And like I said, at the end of classes both days, if you're finished studying or you feel like you've done your due diligence and you're still struggling with certain concepts, please reach out to me and we'll review those.
Okay.
All right?
Thank you. Have a good day.
Yeah, have a good rest of the day. All right. Bye.
Thank you, you too. Bye.
Okay, bye.
Mhm.